Part 10 of respiratory system examination. Mainly these positions are very important. Only posteriorly you place chest like hands over opposite shoulders. See, if you have read superficially or haven't done examination, then you won't get to know this. Axilla, back of head, okay? This there's no way to remember, just like that only you have to remember. Posterior chest, I told you. Anterior chest, if you do something else other than like simply like in front position, then he'll scold you. So direction of percussion always from resonant to non-resonant area. Why means you have to compare. This is a relative rather than absolute thing. So first you have to know what is normal in that chest, right? Then only you can compare and tell it is abnormal, or else you can't. So, because back muscles would be more thicker backside, so that's why you do heavy percussion backside. Here light percussion because thin muscles will be there front. See, this two positions are very important. With this only the examiner will kick you, okay, if you don't do it properly. So examiner had scolded me by for doing direct percussion without stretching the skin. So left hand you have to stretch skin and middle third of clavicle you have to hit. It's also most common clavicle fracture side, like that you can remember. So more the bone is away from the muscle, so it is resonant. It is more nearer, so that is dull, okay. That's why middle third is resonant. So examiner might ask you what is the difference between impaired and dull note. So impaired is somewhere between dull and resonant, okay. You don't feel exactly there is a mass or fluid, nothing collection. So that's why it's seen in early fibrosis or something. So here are the causes, that is partial collapse, mild fibrosis, early stages. Okay. See, dull note they have given properly. Clear loss of resonance due to solid or fluid minute. Then you will get to know something is there. Okay. Severe conditions. So here in Archit Bowler he has given Pankos tumor. Like definitive mass is there. So widening of zone of resonance, you know, pakka. This is like some air filled condition, that is emphysema or pneumothorax. Very easy. So next, I don't think it's important, but still, when you're not able to hear, sunaine there, that's why Gore says suno. Gore knows method of auscultative percussion. So why is it done means in regular percussion it's difficult in obese patient and small effusions and all that. So that's why it's done. You keep flicking tap tap tap. You keep flicking from up to down. The different sounds would be heard in the stethoscope. So that's why it's done. Position of stethoscope, that is 3 centimeter below. So this should mainly be done on the back of the patient. Don't do on the front. Okay, they'll kick you. So coming to lung resonance, just like how I told you about clavicle, so this dullness would be more if more muscles are there. So front chest muscles are less, so that's why it's more resonant. And more alveoli, majority alveoli are there, so that's why it's normally vesicular resonance. So if it's more away from the chest wall or if it is insignificant, so that's why it won't alter the percussion note. So this is where USG, so other parameters take important role.